Hello. Thank you for joining us here on Health Professional Radio for another segment. We're going to have a conversation with Dr. Kristen Hurley. She is Senior Vice President of Nutrition at Vitamin Angels, and she's joining us to talk about Vitamin Angels' new partnership with the Gates Foundation. Welcome to the program, Dr. Hurley. Thank you so much for taking the time.
Yeah, thank you for inviting me.
You weren't always at Vitamin Angels. What's a little bit of your background as a healthcare professional before that?
Sure. I'm a public health nutritionist at heart. I've been working in public health and nutrition for probably a couple decades now or longer. I come to Vitamin Angels from the Johns Hopkins Bloomberg School of Public Health, where I still hold a faculty position there in the Department of International Health in the Program for Human Nutrition. So my background is in public health nutrition research, teaching, and also programming.
This, I guess, an unmet need for pregnant women around the world concerning prenatal vitamins. I'm not well versed in the space. Why is there an unmet need for such a necessary supplement?
Well, something that makes pregnant women very unique is that they're experiencing very rapid growth and development, given that they're having a baby. So they're very, very high risk for nutrient deficiencies, especially if they're living in an environment with high food insecurity or lack of access to quality foods. So because of that, many pregnant women around the world, especially in low resource settings, are at risk for conditions like maternal anemia, which a lot of times stems from lack of nutrients. And this puts them at risk for poor health and then also poor outcomes for their child. So risk of poor birth outcomes, including low birth weight or small for gestational age, or even infant mortality during the first year of life.
Now, is this something that has been ongoing? I mean, we're talking developed nations or undeveloped nations. Is this, when I say worldwide, are we talking across the board? Why would there be an unmet need with multivitamins in some place like the United States or the UK? That's a good question. I mean, there are low income, low resource areas all around the world. Mm-hmm. There are women in the U.S. and pregnant women in the UK that don't have access to National Health Services or don't have the ability to gain access to multiple micronutrient supplements. So I think probably the need is greater in some of these more low resource settings in other countries. But it really is because of the rapid growth and development that occurs during pregnancy, and because that not all women have access to quality health services and products, that's why that equates to a global need. Now, that's even after some governmental and agency help for the nutritional needs of some of these women. Is that correct?
Yeah, again, about, globally, if you're speaking globally, about 70% of the population has access to kind of the national health services, leaving typically on average, it varies by countries, but they're leaving a typical gap of about 30% of individuals, in this case, pregnant women, who for some reason or not cannot access the national health supply, whether it's because they live in a geographically rural or hard to reach area, or they're maybe within an immigrant population. There's a lot of different reasons why certain segments of the population are sometimes at risk of not being able to receive, kind of what the typical health services would be.
What is your mission there? What is Vitamin Angels' mission other than teaming up with the Bill Gates Foundation?
So we're basically a public health nutrition organization, and our mission is to reach vulnerable, so people that are high risk for nutrient deficiencies and hard to reach populations with evidence-based nutrition interventions. Our work focuses strictly on evidence-based nutrition interventions. We only provide for support for things that we know have a positive health impact on women and children. So that includes interventions such as vitamin A supplementation for children 6 months to 59 months of age. That's often paired with deworming, which is a product called albendazole that we also use to support the nutritional status of young children. And then programs like multiple micronutrient supplements for pregnant women.
which of course supports the health of both the mother and the child.
Now, how has your collaboration with the Bill and Melinda Gates Foundation helped to enhance that mission?
Well, the Bill and Melinda Gates Foundation comes together every year to initiate what they call their Goalkeeper Accelerator program. Mm-hmm. So each year, the Goalkeeper announces new initiatives, or what they call accelerators, with the goal of bringing together partners from different sectors, but partners who are committed to a similar outcome. So this year, one of their accelerators is called Healthy Mothers, Healthy Babies, and it's focused strictly on implementing, scaling, and basically connecting more pregnant women with MMS. Again, we know that there's a lot of evidence, scientific evidence, that shows that connecting MMS with pregnant women will increase or reduce the risk of poor health and poor nutrition, and will reduce the risk of poor birth outcomes among their children. But there's a need to this is a fairly new program, so there's a need to expand it and implement it and scale it up. So the Goalkeeper Initiative is really working towards getting multiple stakeholders together towards that goal.
Where can we go online as listeners and get some more information about Vitamin Angels and find out how we could possibly get involved in some of these initiatives with the Bill and Melinda Gates Foundation, as well as teaming up with Vitamin Angels?
Yeah, so there's that information. If you just go to our homepage at vitaminangels.com, you can find information on how to partner with us to work on these types of initiatives.
Great. Dr. Hurley, thank you so much. I know 10 minutes is not a lot of time to cover such a vast topic. Hopefully we'll get an opportunity to have another conversation.
Great. Thank you so much for speaking with me. We're really excited to be part of this Goalkeeper Initiative and to work with our partners towards connecting more women with multiple micronutrient supplements. Appreciate you taking the time too.
Thanks. You. You've been listening to Health Professional Radio. I'm your host, Neil Howard. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes. Listen in, download it SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com, Health Professional Radio.